Thank you, Mr. President. And it is very, I think, impactful for us to be discussing today a problem that's hit all of our states. Senator Blunt and his great work, not just in the Appropriations Committee, but for his state of Missouri, has been very, very active. And I think we all have. I mean, it's a problem that knows no political boundaries. And certainly my state of West Virginia has one of the deepest and strongest and toughest problems. We do have the highest rate of opioid-related deaths per capita. It's not something we wear proudly, but it's something that has really forced us to try many innovative things, to try to be the leader in the solutions. And that's a lot of what I'm going to talk about today, because a lot of what we've seen in the Support Act from all of our individual states have been incorporated into a national response to what is an epidemic around our country that is frightening, scary, and in my view, could almost lead us to losing a generation. And this powerful reaction that we've had through the three pieces of legislation is absolutely critical. So we passed the Support Act. It was signed into law a little bit over a year ago, and that was really as an add-on to the Comprehensive Addiction and Recovery Act that we passed several years before that. But I want to share today, as my part of this discussion, what the successes that have worked in our state and how I think they've been able to be incorporated around the country. We realized after CARA that while we did great with money for rehab facilities and helping our first responders with Narcan and other more immediate problems, there were other things that we didn't focus on that we really need to focus on in order to have a comprehensive solution. And that's the children that are impacted in a home of addiction or exposure to addiction, and also the jobs that are being lost because of it. So we went back to the drawing board and we came up with the Support Act, which is landmark legislation that we're seeing real results. For instance, in my state of West Virginia, the state opioid response grants are the grants that really go to every state in a formula fashion that where you are supporting treatment centers, drug courts, and other responses to the addiction issue. But under the old rule, the money was divided up according to your population size. So I started talking with Senator Shaheen from New Hampshire, small state, impacted more critically like our state of West Virginia, and saying, wait a minute, our smaller states are really not getting enough in these state opioid response grants to really make an impact, to really be part of the solution. And so we pushed hard to change this funding so that the states that are more acutely affected, that have smaller populations, like a Montana, like a West Virginia, like a New Hampshire, are able to get more funding so that we can attack the problem where it is the deepest and the most acute. It helps with our WVU comprehensive opioid addiction treatment, the COAT program, the model that they've put together at WVU for medication-assisted treatment. It helps with our peer recovery coaches and has had a lot of impacts, too, on our children and our families. What we found, too, like every state here, I'm sure, in the state of Arkansas, you probably have more kids in foster care than you've had in the past because of this issue. And according to our West Virginia Bureau of Children and Families, approximately 82% of the children who are in foster care are there because of parents with substance abuse-related issues. 82% of our children, and we have thousands more in foster care, it's directly attributable to this issue. Doesn't even mention all the grandparents and great-grandparents in some cases that are raising children. So, how do we tackle the ripple effects of this issue? Well, you create something that was also created in West Virginia called the Martinsburg Initiative. It's spearheaded by the Martinsburg Police Department, small city very close here to D.C., the West Virginia part that's close to D.C., the Berkeley County Schools, and Shepherd University. So it's a partnership with the Boys and Girls Club of the Eastern Panhandle. And this is based on a CDC study that shows that when children have adverse childhood experiences, it's called ACEs. If you can categorize children that have adverse childhood experiences, if you can identify those children and pay special attention to them through things like the Martinsburg Initiative, you can maybe head off the issues that could come into their future. So police officers come to the schools, they mentor the children. I met them at the Boys and Girls Club of the Eastern Panhandle, talked about the positive influence that a police officer combined with the schools, combined with a college student can have on a young person's life, and in some cases, the most trusting person in their life if they're subject to a home that's filled with drug addiction and opioid addiction. So we saw the success of this, and I joined with Senator Durbin, again, across the aisle to ensure that the SUPPORT Act created some of this, and we are now taking it the next step forward to address these issues in the Rise from Trauma Act, which would help us to build the trauma-informed workforce. We don't have enough people working in this area, and increase those resources in our committees, in our communities. Senator Blunt talked about how important it is to work with babies who are born with exposure to drugs. This is also a solution that's come from, part of the solution that's come from West Virginia, where you're taken out of the hospital setting, the baby's taken out of the hospital setting to try to address the issues of that first trauma in the first days of your life, to try to wean you just off the exposure to drugs, but also to incorporate the family into this so that you can see what kind of pediatric recovery is needed and what the long-term effects might be. You know, Senator Portman has been an incredible leader in the area of working with trying to get the fentanyl that comes in that's killing over half the people that die of a fentanyl overdose, trying to get China to work with China and to work with the post office to try to get the tools to prevent fentanyl, illegal fentanyl, from entering this country. We've had some success, but it's still frustrating. There's too much getting in. I chair the Homeland Security Subcommittee on Appropriations. This is a big issue for our Border Patrol and our ICE agents to be able to make sure that we're giving our post office the tools. Another thing we did was we passed the Interdict Act, which the President signed in, which will help the CBP and also the post office to be able to detect fentanyl, because it comes in these little packages because it's so very lethal. And so lots of what we've done is federal funding, but a lot of what we've done is listen to what our local communities are doing. Listen to how you're solving the problems in states that are highly affected. One of our communities of Huntington has really been a leader in this. One of the most effective strategies that Huntingtons have, and Huntington had the highest overdose rate in our state, is to create these quick response teams. This is when a person comes into the emergency room with an overdose and is discharged. They are then contacted within 72 hours from people from a quick response team from the community, a plainclothes police officer with a health officer or a social worker, and in some cases a faith-based respondent comes and says, are you ready for recovery? When you're ready for recovery, this is where you come. We are your community. We want to help you. We understand where you are, we understand your issues, and we're a part of, we're your neighbors, and we want to help you. And this has had really a very good effect already in the city of Huntington, in Cabell County, because the overdose rate in that area has gone down 26% since they instituted the quick response team concept. So it's going across the country, and part of that is because it's in the SUPPORT Act. So, you know, I have hope for what we've done in West Virginia, but there are way too many people and families that are affected by this. Too many lost lives, too much lost time, and too much lost love, quite frankly. Parents of children who can't sleep at night because the only night they sleep is when they know their child is incarcerated because they don't know if they're going to wake up the next morning. I mean, story after story of just tragedies. And so we're all working together. I think we have a long way to go. I think we've hit on some good solutions. We need to keep the ones that are working, and the ones that don't work, send them on down the road, because we know that there's no one solution to this very difficult problem. So I'm going to continue to fight for every single person with my colleagues here today, and all those folks whose lives are touched by this crisis. But you know what? We're all touched by it. We're all touched. If I ask for a show of hand in a town meeting and I say, who knows somebody that's been touched by this crisis, it's almost unanimous. Everybody raises their hands. So we're going to emerge stronger. I'm optimistic, but this is a long fight. And I'm really pleased to join with so many of my colleagues in this fight. And I think my colleague from Arkansas, who's worked hard on this as well, is the next one up. Thank you.